When you are given a cancer diagnosis, you might have lots of worries and concerns about what that means. And a normal response to those worries and concerns might be feelings of stress, both the physical sensations and the emotional response to that. And because stress is a really horrible feeling, a natural human response is to try and avoid that. And that might be avoidance of physical activities or things in your day-to-day life that remind you of the cancer and the thing that's causing you stress. And while that makes perfect sense, what it means is that our world slowly starts to shrink. Alongside that physical avoidance, we can also start to try and avoid thinking about the thing that causes us stress. We try and push those thoughts out of our mind. And a strange paradox happens when we try and do that. The more we try to stop thinking about something, the more time we spend actually thinking about it. And that kind of thinking can be called rumination. It's a kind of preoccupation with those thoughts that we're trying to avoid. And rumination often comes hand in hand with self-criticism. We can get really annoyed at ourselves at not being able to stop thinking about this thing that we're trying to avoid. And all of those things together can leave us feeling really overwhelmed. And then it's much harder for us to focus on all the other things in our lives. So as a clinical psychology team, what we would aim to do is to help ease the weight of some of these boxes, to try and find ways to feel less overwhelmed with everything that's going on, to try and ease some of those thoughts of self-criticism and to be kinder to ourselves for everything that we're going through, to find a way to manage those thoughts, that rumination that we have, and to find ways of re-engaging with the things that are important to us, to get back to those things in our lives, and to ease some of those physical and emotional symptoms of stress. And what we're left with then is the cancer diagnosis. And while that is still a weight and a box to carry, it's much lighter than carrying all of those responses as well. There are a number of ways we can help people who are struggling to ease the weight of some of their boxes. We have a website that is available to all. We know you will have lots of your own strategies to help you manage, but there may be some additional ideas on our website. There are lots of key topics that are covered that are important to people with cancer. There are several recordings to guide mindfulness and relaxation exercises. You can ask your CNS to support you in using some of the techniques. We support staff to use psychological interventions. CNSs and other cancer staff are trained to assess people's emotional difficulties and signpost or refer to the right level of support. They can also support you in using some brief evidence-based psychological interventions, many of which are found on our website. There are also support groups. The ABC group is run by patients. They recognise that cancer can be a lonely journey, but a group of patients who have been to our mindfulness programme set up a group with others who have been affected by cancer. It includes mindfulness sessions and other topics of interest to those affected by cancer. There's also the Alora Focus group, which runs fortnightly for patients and carers. There's also the HOPE and MBCT groups. MBCT, or Mindfulness-Based Cognitive Therapy, is about learning skills of mindfulness to improve well-being and become more aware of your experience whilst dealing with difficulties more skillfully. HOPE stands for Help Overcoming Problems Effectively. The aim of the programme is to instil hope in the lives of patients recovering from cancer and its treatment. Topics include managing low mood, anxiety, stress and sleep. Finally, we offer one-to-one support. This is for those who have been diagnosed with cancer, as well as their adult family members. We use a range of evidence-based psychological treatments. There is an opportunity to help manage psychological difficulties and to talk about the impact of cancer and how to live in a way that makes the best of a situation. Your CNS can assess you and signpost you to the most appropriate services. If you want information about any of these things, please speak to your CNS.